Sihat beyond the clinic, kesihatan everywhere dari rumah ke community, showing people that we can.
I can sum it up like healthcare is also national security lah. As you mentioned, we should have more preparedness in terms of our health systems, and you mentioned healthcare financing, and that also means that us as Malaysians, we should also take ownership of our health. But we sometimes see news that say people are not ready to pay for increased healthcare costs or medicines, nor live a healthy lifestyle. What would be your message or your hope to see that people take more ownership of their health in terms of accepting healthcare financing? And what will be the role of our government of Malaysia to ensure that this is in place?
So at the individual level, I think our preventive medicine is not as strong. So when you look at the whole continuum of care, Malaysia is a curative-heavy country. We do little, or I would say non-impactful preventive medicine programs and practice, as well as we do little with rehab. So when I talk about the whole continuum of care, but we are very good at curative. So we are building more and more hospitals, but we're not focusing on preventive medicine. As a result of that, individuals in Malaysia are less responsible. Not many are knowledgeable enough about preventive measures that should be in place to prevent you from getting any chronic diseases or NCDs, cancers and whatnot. And hence, I would say individual practice alone in Malaysia, even though the health literacy is rising, but the rate is still relatively very low in comparison with other countries. So that is at individual level. When you look at national level, we need to migrate from curative focus to also covering preventive medicine and also providing good rehab services. So the only way to do that is, as I said, through a wider financial scheme, which is able to integrate primary care services. So yes, we do have clinic kesihatan every district, but we have only one per district. The most maybe 3 in larger districts, but it is not sufficient. It's burdening already, and you know that we have thousands of GP in Klang Valley alone, and we are underutilizing their skills. So if we can rope in some of the private GPs to provide good continuum of care under the supervision of family medicine specialists, probably maybe you can have 4 or 5 clinics under one family medicine specialist supervision. Who will pay for this? It should be the complementary mechanism, financing mechanism, which is a co-contribution system. So if you can have this system in place, for example, at preventive level, you involve all the private GPs. At curative level, you can involve the private hospital. Let's say the waiting time for elective surgery is an acceptable limit is 4 months, let's say, or 3 or 4 months. If it exceeds that, you can refer the patient to private hospital, paid for by the National Health Fund. If not, it will be covered by the usual government funding scheme. If you have a ventilator issue, for example, for a neonate, you don't have to back manually all the way from KL to Perlis just to look for ventilator. For example, if you have a neonates delivered in Hospital Kuala Lumpur, you can just send the patient across the roundabout to Tawakal Hospital and use the ventilator there and paid for by the National Health Scheme. Of course, we need to have ceiling. That's why DRG comes into play. So we can have a ceiling of price and all that. That is agreed upon. In terms of affordability, we are not suggesting that everybody start paying now. There is a term known as self-insured. And this is for the bottom 40% group, B40. For the poor, I think the best way forward for now, self-insurance paid for by the government. For the M40, you have co-contribution, employee, employer, and government. And of course, for the T20, you have to pay. Will the T20, despite having self-insurance, most of them will have own insurance, be taking the national health insurance? The answer is yes. Because in Malaysia, the system is the other way around. Not all complicated cases can be treated in private hospital. If they run into complication, most of the time they will send back the patient to public hospital. So don't you want to get yourself covered? Second, the age limit. You have age limit for your medical card, but for national insurance, it shouldn't have any age limit. So it is a good complementary mechanism. And the way that the government should implement it is we always pilot first. Do not be reactive. I usually go against knee-jerk reaction. So somebody comes with a new idea and you straight away implement it. It must be implemented in a phased manner. So we should start with the pilot study, maybe in Klang Valley or and in a few other places, southern region, northern region, East Malaysia. And then you study the mechanism, whether it is working well or not, what are the weaknesses and all that, and improve upon it before implementation. We are moving towards a high income nation, but the gap of income between the super rich and the poor is widening. And this needs to be addressed too. This is out of the scope of public health. This is for the government to bridge the gap. So you need to know that our income has been stagnant for more than 2 decades. An engineer who graduated in 90s are getting a starting salary of 3,000. You are still getting that salary now. So what is happening to us? We are not moving anywhere. So what if in 2 years' time we are going into a high income nation status? Probably it does not reflect the whole population. So the government must take into account measures to try and uplift or bridge the gap in this area and improve the income of the lower income group first, as well as improving the quality of life for the middle income group and not victimizing the top income group. It's what we are currently seeing. So it must be a fit for all scheme, insurance scheme, a fit for all alternative financial scheme to solve healthcare sustainability issue. So it is not an issue of affordability. Once the citizen of Malaysia understand the importance of it, I think a nominal fee per month is acceptable. We're not talking about a huge amount because a national health fund usually does not involve too much of a personal funding. You're talking about a pool funding, and the pool funding is supposed to bridge the gap rather than replacing the whole government funding. So this is the difference between us and other countries. Other countries, when they migrate towards National Health Fund, it is fully funded by the National Health Fund. What I am proposing now is a hybrid mechanism where government funding continues, education funding continues, but in both sectors, we do need an alternative funding mechanism.
That's an excellent idea because I did hear this once. I mean, this was one of the suggestions from the Ministry of Health earlier when we had one of the discussion during a health economy forum that why not the suggestion comes from the employers themselves that actually implement a scheme where within the salary itself there's a small deduction where it goes for a very general simple insurance funding, and it gets carried around. Like how right now a lot of employers actually hire TPAs, third party administrators, to actually, TPA is a whole different topic, but third party administrators to actually assist into aiding for medical card and also outpatient treatment and all that. But instead of doing that, why not standardize a particular scheme where it just gets carried forward? If let's say the employee is here with, for example, with X company, and then when they go to a company Z, it just continues. They just continue paying, and it's actually a co-payment funding as well. So the employer able to pay a little bit, employee also contribute a little bit, and I think there's a majority funding coming from government as well. I think that's an excellent idea, Prof. I think I hope it gets actually implemented. In terms of policy level.
There's an existing mechanism in SOCSO, but SOCSO only covers work-related accident, curative treatment and rehabilitation. Why not expand SOCSO? Since SOCSO is a non-profit agency, and expand its role to manage this. With the funds that they have and the pool funding, I'm pretty sure SOCSO would be able to do a better job. I'm not really in support of utilizing KWSP because that is your pension
Saving,
fund. So it shouldn't be touched in a way. People didn't realize that if you use your KWSP, you are actually using your own money. It's the same thing.
It's actually
Because
your
it's
saving.
it's not coming out of your pocket, it is okay.
Yeah.
If they see deduction in their payslip, it's not okay. So we need to change this mentality.
I think we are going towards the end of the session. Prof. Arshil, thank you so much for sharing your thoughts and insights over the current topic that we had today. And I think conflicts like this often remind us that health, security, and also global stability are very important. And I think a modern country is always not measured on how how high raising buildings we have, and it also depends on how high the thoughts of the public and also the leaders of the country are. So I think it's very important in that sense. So one last message that you would like to give to our listeners, to our fellow Malaysians, before we conclude today, Prof.
I have seen it all throughout my 25 years of service in the military, where I have served in many conflict areas. In Afghanistan, in Lebanon, I have served in Western Sahara, I have served in many other places with crisis. So people in these places, they're fighting for decades to achieve unity. In Malaysia, we are blessed with unity from independence. But now I am seeing a trend, a dangerous trend, especially among the younger generation, that is stirring racial issue for either political reasons or for whatever reason. On the other hand, we are trying hard to destroy the unity that we have achieved for 8 decades. And why we are doing that? Trust me, you do not want internal unrest. You do not want civil war. You do not want any conflict within the country. So my advice to everyone is be united. And of course, we know we have always been known as having one of the most high tolerance level in the region. So my advice is we should maintain that and be united as a Malaysian.
So with that, that would be our take-home message. Thank you so much to all our listeners for listening to us. This has been Sehat Beyond the Clinic, and where we explore and understand further about what healthcare landscape is about in the region. All right. Thank you so much, everyone.
Thank you, bro.